Health Commissioner Dr. Allison Arwady joins us now. First of all, thanks for being with us and thank you for all your work during the pandemic.
Thank you for having me.
So vaccination rates are slowing, the virus still circulating. Do you think we've reached the as good as it's going to get point of this pandemic?
So we're continuing to make progress, certainly on vaccines every day. We are doing thousands every day still here in Chicago, but you're right, interest has decreased. And my worry is that what we're seeing around the country is that cases are on the rise and they are very heavily landing on unvaccinated people and unvaccinated communities. And so my hope is that while we remain in very good control right now, is that if people are hearing this and they haven't yet made that choice to get vaccinated, doing that now helps protect you for if we do start to see more of an increase here.
Good advice. You know, we've been talking a lot about this Delta variant, and I know for a long time we've been very concerned about the Latino and the Black communities here in Chicago. Are you noticing that that variant maybe is having an impact on the cases there, or do you have any numbers on that yet?
Yeah, so we certainly have plenty of cases of the Delta variant here. We have plenty of cases of all of the variants of concern that have been detected. And the Delta variant is twice as infectious, as contagious as even the Alpha variant, which already was twice as contagious. And so what we're seeing is that when people are getting COVID right now, there's a good chance that they are getting a variant and therefore spreading it more easily. And so again, the vaccines do protect against all of the known variants, including Delta, but in some of the social networks where people are not vaccinated, we are seeing these variants spread. So again, get vaccinated, protect yourself.
But for months now, you've made a big push to really get the vaccine into underserved communities that were hit especially hard by the virus. Is that message being received, or are those communities still the ones with the highest case counts?
They are still the ones with the highest case counts because they're the ones with the lower vaccination rates. About 3/4 of the vaccines that we're doing here in Chicago each week are in Black and Latinx Chicagoans, which is good to see because that is where we still have the most work to go. So again, there are plenty of people making that decision every day, and we are focused. We're knocking on every door in our least vaccinated communities. We have vaccine available at home, 312-746-4835. We will come to your house and give vaccine to you, your family, your friends, and we'll give you a Grubhub gift card while we're at it. So make a party out of it and get vaccinated.
Here you go. Everybody likes a party. Okay, I want to keep talking about the Delta variant because this week Pfizer announced that it is developing a booster vaccine. So have you started to develop a plan as to how you would distribute that booster vaccine if it is in fact needed and it is something that the city decides to do?
Yeah, so first let me be really clear that there is no recommendation at this point for a booster vaccine. So if you've had both of your doses of Pfizer, both of your doses of Moderna, or your single dose of J&J, you are set. You do not need to get another vaccine at this time. I'm glad to see pharmaceutical companies doing that research and being ready in case we were to see another variant emerge or another change where we would need to recommend another dose of vaccine. And the good thing is we have a great network in place here for immunization. We had a strong network prior to COVID, and we've grown it really well. We've learned a whole lot about how to vaccinate efficiently, quickly, get information out, use trusted community messengers. And, you know, still, people are walking into pharmacies all over this city and getting their regular COVID vaccines. If we were at a point down the line where there needed to be another dose, I'm very confident that we are in a good place to do that. But the most important thing is for people to get those first doses.
Right.
I'm still much more concerned about that than any potential of booster, which would be quite a ways down the line.
So since kids under 12 can't get the vaccine, what's to prevent outbreaks when schools resume this fall?
So the good news is that we really saw that where schools are putting good protection measures in place here in Chicago and across the country, they are not significant sources of outbreaks. There will be cases that could come in, right? Especially if there are people who are unvaccinated. But where things are in place, we've not seen them drive community cases. We've not seen major outbreaks. It's one of the reasons we were really pleased with the CDC guidance today, really strongly saying 5-day in-person education. It does mean, you know, kids kids under 12, the CDC says, for example, that you need to wear masks, right? If you're unvaccinated, and that means masks will be part of school, particularly, you know, for those younger children who have not yet had the opportunity to be vaccinated. And CPS and all the schools in Chicago are all going to be doing as much as they can to make sure that our settings are as safe as they can be. So I feel very good about where we are as a city as we plan to return to school. And I really, really, really want to encourage folks that if your kids are eligible for vaccine, do it now so that they're fully vaccinated by the time school starts.
All right, some good insight. Thank you so much, Chicago Health Commissioner Dr. Allison Arwady, for joining us today. We appreciate your time. Have a great weekend.
You too. Thank you.
Thank you.